Access to life-saving equipment and an awareness of basic first aid can be vital in improving a person's chance of survival in an emergency.
Now, St John Ambulance is calling for trauma kits, which would include military-grade dressings and tourniquets to be installed in venues like football stadiums and train stations to help save lives in the event of a stabbing or a terrorist attack.
Let's speak now to Richard Lee from the St John Ambulance Service and Consultant General and Trauma Surgeon Nikhil Misra. Good morning to you both. You walked in with this kit and the first thing Sally said was, we thought a trauma kit would be... That's it.
This is it. So we've been teaching first aid in communities for the last 150 years at St John. And as the sorts of injuries we see change, first aid needs to change. So today we're really delighted to be partnering with Citizen Aid, one of our fellow charities, and the National Counter-Terrorism Office to provide guidance to people on what they should have in an area to provide first aid for really serious traumatic injuries, not a cut finger, injuries where people may bleed to death before professional help arrives.
What's in it?
So in this kit is a range of equipment to stem bleeding. The preventable cause of death in all this is bleeding. So we have some face masks because we're in COVID times, we have some eye protection, we have a tourniquet to stop somebody bleeding from their arm or their leg if dressings fail. And in here we have some military grade, as you say, dressings. So these are not dressings that you find in a first aid kit. These are dressings to stem major bleeding where somebody will die before professional help arrives. It all sounds very frightening, but it really isn't. It's the same as putting on any other bandage. We've all done that at home. When you cut your finger or something, you put something over it to stop the bleeding. These are the same. They're just more sticky, they're more elastic, and they hold themselves on really tightly.
Because as soon as you say the word tourniquet, that makes me slightly panic, and I think in an emergency situation, I am not sure I would know what to do, or many people would know what to do.
So these are really serious emergencies. This is somebody with a wound to their leg or their arm where you just cannot stop the bleeding, and every minute counts. So applying a tourniquet, if dressings don't work, applying a tourniquet, either a professional tourniquet like this one in the kit, or an improvised tourniquet using something like this first aid device, a tourniquet, which our colleagues at Citizen Aid have designed, will save somebody's life before professional help arrives.
Fascinating. Nikhil, let's bring you in as somebody who deals with trauma patients regularly. It looks very, very straightforward, actually, from a non-medical perspective. How much of a difference could this make for patients that you see coming into A&E?
Yeah, massive. So this could be the difference between life and death. And I mean, these kits will undoubtedly make a difference. They're a positive step forward. There is similar bleeding control kits in different areas, a couple of different areas around the UK already. There's some bleeding control kits which have been organised by the pioneering Daniel Baird Foundation in Birmingham, around 2,600 kits. In Merseyside, our own campaign, the KnifeSavers campaign, has distributed around 900 kits in the last just less than 2 years now. Now, we've got documented evidence of 4 cases of these kits being used and the training that we've given behind them having stopped major bleeding in knife-related incidents. So, I mean, this is going to work.
Do you know what struck me when I started reading into this story? The fact that this is necessary now is quite depressing, isn't it? As your time working in medicine, have you noticed this trajectory going up in a significant way?
Yeah, that's a really good point, actually. Yes is the short answer, and we have the metrics to prove it as well. National trauma data, university-based data in Liverpool and different areas around the country have actually shown this upward trend, this almost, it's almost become endemic in society. I'm specifically talking about knives and knife crime here. And that has been proven both by myself and people on the front line and also with numbers, with data as well.
Richard, how important is it? We're talking about timing here, aren't we? We're talking about minutes, the minutes after an attack, that golden hour after something has gone very badly wrong. How important is it that help is sought super quick?
So in severe blood loss, every moment counts. You've got to stem the bleeding. And we're used now to seeing fire extinguishers and defibrillators in public buildings for fires and cardiac arrests. This is the next stage. This is immediate action for trauma. 200 people died last year in the UK from knife-related injuries. Some of those patients may have been saved with better first aid. Our mission at St John is to make sure nobody dies because first aid wasn't available, and this is about giving people the right equipment.
And Nikhil, I've just got a question for you, which is that, in your job, a trauma surgeon, I just asked Richard there, how important are those minutes after an event like this when someone presents, when someone is brought to you, whatever state they're in, what are you looking at? What is the situation, and what are what are the things you're trying to deal with in that point? How long do you have to save someone?
So yeah, again, an excellent point. Bleeding is time critical. As what we say when we go to schools, we go to parts around the Merseyside to teachers. It's like a stopwatch going off. And as soon as that injury has occurred and blood is coming out, that stopwatch has started, and you've only got minutes, around 5 minutes, 4 to 5 minutes for such massive blood loss from a major artery or a vein until the heart starts to weaken and to stop. Now, this is much more pertinent nowadays with the whole healthcare system under such pressure. It affects ambulances and ambulance waiting times, and this is reported in the press a couple of days ago. And there is this vacuum of what we call a therapeutic vacuum, where you ring 999, or someone rings 999, and then there's a wait for help to arrive. And this is exactly where these kits come in, the St. John's kits, the KnifeSavers kits, the Daniel Baird kits. We want them pretty much on every street corner. But what's more powerful is the education underpinning how to use them and what to do if you haven't got one.
And that's it, isn't it, Richard? It's having those in football stadium, for example, but also knowing what to do with them. How do you improve that awareness?
So we want people to have the confidence to use this kit. If we travel to our website or to Citizens Aid website or several other organisations, there's lots of advice on how to apply a trauma dressing. But we're all used to putting plasters on and putting bandages on when we cause ourselves minor injuries.
Would you very quickly show us how to put a tourniquet on? Because I
certainly
no
can.
idea.
So if I use this one, a Velcro one, you can see that in effect it's just a big loop. So you apply the loop onto the limb that's bleeding, and then you tighten it up. And having tightened it up, once it's attached round, there's a windlass, and this is the thing that you turn that makes it tighter and tighter. And you should turn this until the patient's hand goes blue. This needs to stop the blood flow. So you need it above the injury and tighten it up till the bleeding stops.
See, that's the kind of information you'd need alongside having the kit in your hand, isn't it? So
so the kit has instructions within it, and all the equipment, the wrapping, has easy to follow instructions. But really, these patients are at risk of death. So in the same way that we encourage people to use a defibrillator, you really can't do them much harm. This is about trying to save their life.
It's an important message, isn't it? Because I think people are slightly frightened that they might hurt someone or make it worse.
But in these situations where the patient is at imminent risk of dying, it really is very difficult to do anything to make the situation worse. The same with a community defibrillator. It's the same with this trauma kit. If somebody's bleeding severely, get a dressing on and stop that bleeding. Do whatever you have to do. Push as hard as you have to push to stop that bleeding till the ambulance arrives.
Nikhil's nodding. Presumably you've never said to someone, I wish you hadn't tried to help.
No, never. As I said, we've got documented evidence where we know this works, basically, and as exactly as was just said then if you don't do something, that person in front of you has got a good chance of bleeding out and dying. So anything would really help. And what we do in the KnifeSavers campaign is to teach it a very simple algorithm: A, B, C. A, be alert, ring 999, make sure you're safe. B, where's the bleeding coming from? And C, 2 hands, press hard. You know help's on the way, and you're stemming the bleeding. And this is all used before these packs come in.
Really good advice. Trauma surgeon Nikhil Misra, thank you very much. And Richard Lee from St John Ambulance Service. Good luck with the campaign. It's one of those very simple but brilliant ideas, isn't it?
Yeah, thank you very much. Thanks, Richard.